Hello and welcome to another episode of the De-Stress podcast with me, Dr. Amanda. Thank you to everyone that has been listening so far. We have another really exciting episode for you. On this podcast, I like to highlight the often underestimated impact that stress can have on our lives and on our bodies and give you practical tips on how to deal with it. So today's episode, I sit down with Hannah Pearn, who is also a podcaster, but she is an acupuncturist with a special interest in fertility. If you are someone that wants to have children, someone that is struggling to conceive, this podcast is for you. We talk about the relationship between infertility and stress, and also we kind of deal with that very unhelpful phrase, if you just relax, you'll get pregnant. I hope you enjoyed the episode. Stay tuned. So hi, Hannah. Thank you so much for joining me on the podcast today. Before we get into it, I just wanted to give you the opportunity to introduce yourself, let the listeners know who you are, then we can get into the conversation.
Thank you so much for having me. So my name is Hannah Pearn and I am an acupuncturist and a fertility awareness teacher trainer. I specialise in fertility and we've got a team. I run a team of practitioners, all of whom support people who are trying to conceive. We've got 2 clinics in South London, but we also do a podcast. So I release a weekly podcast about fertility, and we've got a community Facebook group where we run events and information and live Q&As, because the thing that we see a lot in clinic is that people feel quite overwhelmed with information, like where do you go for information? And a lot of people kind of feel like they've missed the basics. So, I trained as a fertility awareness teacher because so many people used to come to clinic and they'd be like, I can't believe I didn't understand my menstrual cycle. Can't believe how little I knew about actually achieving a pregnancy and a healthy pregnancy. And so I thought, okay, so there's a real gap of information in this area and it leads to people feeling quite overwhelmed and stressed. So a lot of the work I do is around sort of raising awareness around supporting your fertility, tracking your menstrual cycle, knowing when you're fertile, knowing what a good menstrual cycle looks like so that you can then approach your GP and get really good support, because people often find that they don't know where to turn to and they might not realise that it could be an indicator of a problem that might be impacting their fertility.
Brilliant. And that's the thing, what you're doing is just such important work. It's just really awesome. And as a GP, I see so many people that are struggling with fertility issues, and often not knowing where to start, where to turn. And although we do have information, a lot of us as GPs, we're not experts in fertility. And before you can get a lot of help, you've got to have been trying for a certain amount of time to get help in the NHS. There's lots of things that aren't available to some people, depending on your criteria. If you had children before, if your partner's had children, you don't. There's so much complexity there, and often in the NHS you only get a few minutes to really discuss things, and so it's excellent when we can find people like you who are doing things like this, and your podcast giving out that information is really essential. There were a number of reasons why I wanted you on the podcast. So when I think it was more so when I started trying to have my own children. I didn't have any fertility issues. My issues with children really come in the pregnancy and with the birth. But with actually getting pregnant, I found it it was a very smooth process for me. But as I started that journey, you start having conversations with people that you don't have before. And so I started speaking with friends about trying to conceive and learning about how many fertility issues are out there. I saw it already in my day-to-day work as a doctor, but actually people in my personal life, you don't realize how many people are struggling. And so this conversation of fertility, especially since I came online onto Instagram, just keeps coming about. And something that we get told so often is when you just relax, when you calm down, when you relax, you'll fall pregnant. Stop thinking about it. Stop trying. If you stop trying, you'll get pregnant. It's just that you're stressing yourself out too much. And so, and then that's the thing. The link between stress and fertility issues isn't as strong as a lot of people make out. but the fertility issues itself can cause a lot of stress and a lot of overwhelm. And so it's really talking about how we can overcome those things and what is the real impact on stress on our fertility, because, you know, it's important for us to have babies and keep having babies for the continuation of the human race. And so it's a really important thing for us to talk about. But before we get into that, I really want to get to know you a bit better. And I wanted to know, how did you actually get into all of this? So you're in acupuncture. How did you get into that? And then how did you specialize in fertility?
Well, I got into acupuncture because I had acupuncture when I was pregnant with my daughter, who's now 18. So it was a long time ago. And I had acupuncture to induce labor. So acupuncture can be really helpful to kind of encourage natural labor to start, because it's very good at kind of increasing oxytocin levels and reducing stress. And so I'd never had acupuncture before. I was about 39 weeks pregnant. I had three sessions of acupuncture. I went into labor on my due date and had a really straightforward birth. So it really blew me away, actually, that
Awesome.
it could be so powerful. And then I kind of continued to use acupuncture because I had a thyroid problem that came about after I had my daughter. So I sort of used it just for general kind of health and well-being. And then I have not had fertility struggles like yourself. Like, you know, getting pregnant wasn't a problem for me. But I retrained when I had my son, so my second child. And then I started work. And the reason that I went into fertility was because the vast majority of people who came to me were looking for support with fertility. So it was like, it wasn't something that I had personal experience of, but it was something that came through my door. And I quickly realized that if I wanted to really support people properly, needed to really specialize in that area, because I couldn't be a general practitioner, because I needed that real depth of knowledge. So I very quickly specialized, and work in sort of women's health and fertility is kind of my bag, and that's kind of where I've put all my further education, further research and training has always been in that area.
Okay, brilliant. And so you saw the need. So you saw the effects of acupuncture on yourself, and that brought the interest, and you saw the need for fertility, and that's why you went down that route.
Yeah,
amazing.
Exactly.
And so what did you do before you actually went into acupuncture?
Well, randomly, I was an event fundraising manager. So I used to work for and weirdly, what's really weird is in my very first job, I was a teacher, and I was a teacher overseas in China. So I would love to tell you that, like, that's where I found my love for Chinese medicine. I lived there for 3 years, never came across Chinese medicine, but
that's so interesting.
Yeah, it was really weird. I was a teacher for a charity, came back, worked for the charity, and I sort of feel like I've gone full circle, because I do a lot of teaching. So I teach other acupuncturists. I obviously teach people about fertility awareness. I do a lot of, campaigning and awareness raising. So I sort of feel like, yeah, it's all kind of come together.
Yeah. So it's just that it was always simmering away, maybe the Chinese medicine, and just like building up until you finally found, I guess, your niche. Yeah.
And actually, when I was at school, I did actually want to be a doctor, but I was really rubbish at science. So I did so badly in my science papers. I just was like, there was no chance I was ever going to do it. So I sort of feel like it all came together in the end.
Okay, brilliant. And so I'm actually on a journey myself now of learning more about alternative therapies rather than just like traditional medicine. Part of it a lot of it started with having my own children. And it's just that I found before having children, I never had any personal health problems. And I guess before I had children, I didn't find myself really going into those in-depth conversations with people around me and coming online and things. But since having children, I started finding myself like having pains around the body that I didn't have before, having to recover from surgeries, and like having more mental health struggles. And so I really started having a deep dive personally into these alternative therapies. And I've always seen that medicine, so many things can manage through lifestyle measures and more holistic ways rather than just like medications and surgeries and things. And so I've always had this interest in lifestyle medicine. But when I started having health issues myself, I started looking into that. And through lifestyle medicine and through my own recovery, I started finding these things. And so I've actually started I haven't had acupuncture as yet, but I've had dry needling done because I've had a lot of issues with my back and things. That's really helped. And when having my 2 daughters, I had reflexology. to help me go into. So one was for with my eldest, I was having a lot of anxiety in the pregnancy and pelvic girdle pain. And so I had reflexology for that. But then I was induced just before like the labor induction reflexology was needed. But then for my second, I had the reflexology for anxiety and also for induction of labor. And I remember my second session of reflexology, I had a show and then I gave birth like within 2 days of having that reflexology.
Amazing.
And so, yeah, this stuff really does work and it really helps. And so I was really grateful to have that. And so I'm just kind of learning more about these alternative therapies. But would you tell me about, so acupuncture, how does acupuncture actually work? How does it affect the body and have these impacts?
Well, from a Chinese medicine point of view, acupuncture, in Chinese medicine, they believe that there's 12 meridians. So like they're like channels of energy that run through the body. And in Chinese medicine, everything is about balance. So, there's the yin and yang sign that I think most people would know and associate with Chinese medicine. And what can happen, the belief is that if there is a blockage in one of these channels of energy, if you think of them like electric circuits, then that cause like disharmony or pain or kind of imbalance and ill health, whatever shape that may take. And so the use of needles on these channels kind of helps restore the flow of the energy. So we talk about qi or energy. And so using those needles in whatever place we think is appropriate can just help kind of rebalance the body and create health and well-being. I mean, it's really interesting because I am actually quite scientific. I quite like concrete evidence. And when I trained to be an acupuncturist, it was the thing that I used to always ask, like, but why? What is this chi? You can't see it. Is it a thing? Is acupuncture real? Is it placebo? I really struggled with it, which was odd because I'd had it myself and I knew how powerful it was. Yes. But when you study it, you're like, it doesn't actually make sense. And so in a kind of, I've thought about this long and hard. In a Western medicine perspective, what I really think acupuncture is really good at is switching off the stress response. So if you think about it, if we've got lots of adrenaline, lots of cortisol, that really blocks our other body systems, whether it's your sleep, so your body's ability to relax, your digestive system, your hormone system, those kind of high levels of stress and anxiety really block that system working correctly. And what acupuncture really does is it switches off your stress. And that has been proven, they've done studies on it. It reduces adrenaline, it reduces that cortisol output, and it relaxes the body. And so when the body is relaxed, a bit like when the body's asleep, systems work well, systems regulate, cells repair, the body kind of rejuvenates itself for another day. And I feel like that's what acupuncture does. If you wanted a Western medicine explanation, which I always do, is it just puts that body into that rest and digest state, which I think is a better place for healing to take place. Sorry, that's my dog.
It's all right, he's very cute.
Sorry, I've just let him out. Hang on.
No problem.
Sorry.
No, don't worry at all. And see, that explanation really helps me as well, because from the background that I have, I understand the things that, having faith in things that, you can't see aren't tangible, but because my training is very scientific and very evidence-based, it's sometimes a struggle to grasp it all. And so having those explanations really do help to see how it can affect. And we know that, the impacts of stress are massive, and doing anything that you can to try and put your body into that more relaxed parasympathetic state where your metabolic needs are reduced and your body can restore itself is so essential. And so we've spoken on the podcast before with a massage therapist about how massage can do that for you. And now we can see how acupuncture can also do that for you as well.
Yeah.
Now, so I want you to share with the listeners, what is the name of your podcast?
So my podcast is called Don't Tell Me to Relax. And it's also the name of our Facebook community group as well. And obviously that came out of that saying that people who are trying to conceive are frequently told, just relax, just go on holiday, stop thinking about it, you're overthinking it, all of those really unhelpful phrases that people are, really you know, it really disregards the stress that they're under. It really like minimalizes it and is really unhelpful. So it's an ironic take on that, basically.
Yeah, I loved it. That when I saw that, I was like, yes, this woman, this group of people are on the same page as me, because that's what you hear so much of. And you hear people saying, just stop trying. When you stop trying, just relax, have fun, then you'll get pregnant.
Yeah.
And it's like, it's so easy to say that, but how can we practically do that? And it really does disregard the real stress that people are under when trying to conceive. It's a massive thing to undertake.
Yeah.
But when I see, the thing is, stress does impact our menstrual cycle. It does. And so stress in turn can impact our ability to have children, to go forward there. And that's why it's so important to have things like acupuncture, where we can actually do practical things to reduce our stress. We know that if you've not tried to conceive, say you're listening to this and you're not in a place right now where you're trying to have a baby, but you may be in the future, you may want to, you may have noticed times where you're under increased stress, whether it's that you've lost a family member, or you've got career changes, or you are moving house or something like that. You may find that your period comes a little bit later than you expect it to, or you can see like fluctuations happen there. And so a lot of us have experienced how stress can affect our menstrual cycle. But what I wonder if you could share, like, what is the impact that stress really has? Is it as big as we think it is? Do we put too much onus on that?
It's complicated. So it's interesting because different studies, and this is the problem, isn't it, with science, and it really is the problem, especially around fertility, because conclusive evidence and science around fertility is actually quite difficult, and because the science changes quite a lot as well. In the 10 years I've been working in fertility, what is kind of considered as, especially in the world of IVF, the medicine and the science there changes hugely, and something will come into fashion and then it will go again. And this idea about stress impacting fertility is complicated. So there are a lot of studies out there that show there is no impact. So for example, they've done studies on IVF outcomes on people who have been actually diagnosed with, let's say, anxiety and depression. So people who've had a medical diagnosis, they might be on medication, and they've looked at the IVF outcomes of those people, and they found that people with anxiety and depression, actually, there is no difference in the outcomes of whether they achieve a positive pregnancy or not. So if you think, people who are anxious and depressed are under quite a lot of stress, and that, you would think that would have an impact, and it doesn't. The other statistic that we often refer to is around, areas where there is war going on. So birth rates don't actually change a huge amount when there is war, and that continuous stress that people are living under. It doesn't seem to have the impact on the birth rate that you would think. So it's not that complicated, it's not that obvious. But like you said, we do know that stress impacts things like, it can impact your sleep, it can impact your digestion, it can impact what food choices you make. So you might be more, up for sugar or convenience food. You might drink more, you might smoke, because of the stress, you might have more caffeine. And we know that all of those things can then impact your menstrual cycle and your general health. So I always say it's never like a straight line. It's a bit dotted, curved line. And I always say to people, when we work with people, what we have is that, in the beauty of, private medicine and people paying for acupuncture, is that we have time. So unlike yourself, you have 10 minutes, we have an hour and a half for our first appointment, and we sit with people and we go through all of their systems. So we'll ask them about their sleep, we'll ask them about their bowel movements, we'll ask them about how they feel in their body, do they have any anxiety, do they have any panic attacks, any kind of we'll ask them about their eating patterns, drinking, all of those things. So what we can do is make an assessment of, is this person's stress impacting their fertility? So say, for example, if they're not sleeping, if they can't get to sleep at night, or they're waking up at night and they're overthinking, and we look at their cycle and we see that they're having delayed ovulation, then we can say, we think that, the stress of whether it's work or fertility could be impacting your ability to sleep. And we know that good sleep is related to good hormone production. And so that could be the reason why you're ovulating later. And so that's kind of what we work on. We'll work on supporting sleep. We'll talk about sleep hygiene, and we'll use our acupuncture to really, switch that nervous system response off. So it's never really clear, but you can unpick it and you can see, and it's also very individual, because I work with some people who are under unbelievable amounts of stress, and their body systems are fine. They walk in, they tell their story, and you think, oh my goodness me. And this person, they sleep well, they open their bowels daily, do exercise. So it's so unique, isn't it, to how individual bodies carry stress. And a lot of it is to do with your life history, your family circumstances, your support network. It's complex. So saying that stress causes fertility problems, I think it's a stressful, unhelpful thing to say, because it's not that simple.
Thank you, because that's so important, isn't it? Because what you said there is that we have seen, like you said, countries who are in war. There's been periods of time in history where the whole world has been, we've had 2 world wars, and we've had places where there's been rations. We've had times where, even if we think about slavery, where big groups of people were being taken on, like, away from their homes, put in slavery, and still they were able to have children. And so we know that high levels of stress isn't the be all and end all in terms of you having a child. And so that should really just, when people are coming to you and saying those things and you're struggling, understand that it's not all down to you and down to the amount of stress that you're under. You can still have a child in a stress situation. I'm someone that has been under a lot of stress, even whilst trying to get pregnant, and I still get pregnant. The stress then increases when I am pregnant. That's a different story. But it's not the the essential, the crux of it. It's not the thing that is stopping you. But then it's also important to recognize the impact that stress does have, and actually seeing how it affects your body, and seeing if there are unhelpful habits and behaviors that are coming as a part of the stress, and then that indirectly not helping with your ability to have children. And so that it's just is that two-sided coin, isn't it? That don't let the stress make you feel like you're ruining things, but also how do we manage it as well, so that we can optimize not just your ability to have children, but your just health in general. Because all those things that you said, if your sleep's impacted, your body's ability to stay in like homeostasis or balance really just goes out the window. When you're sleep deprived, even your appetite changes. You start to seek more carbohydrate rich foods, and we know that highly processed foods and high sugar foods are like what I call the pandemic of modern day at the moment. And so trying to hack those things and finding out how we can reduce stress for our overall health will hopefully impact and have a good effect on your fertility as well. And so when it comes to some practical ways then, so if you are trying to have a child and it's becoming quite stressful, or you're stressed in general because of other factors, maybe family issues or whatever, and you want to try to do practical things that these issues that you're having, maybe it's been a year you've been trying and you're not getting pregnant, what kind of things can people start to do?
Well, to address stress, I think it's important. I mean, the thing is there's no one right answer. So first of all, I think it's important to acknowledge that the stress, look at what the stress is doing to your body. Like, where is it showing up? Is it in your sleep? Is it in your digestion? I think it's important to be really kind to yourself and know that, you're a human being, and, stress is a normal part of life, and this is a normal body response, and that, fertility is so complex, and that I can guarantee that the stress you're under is not the only reason why you're not conceiving, because it is always multifaceted, and it is never one thing. Very rarely is it one thing. It's usually a combination of factors. So I think, be really kind to yourself and speak kindly to yourself. It's not your fault. It's not because you're stressed. But I also think it's important to acknowledge the stress and look at ways of how you deal with that. And that is different for lots of people. Like, for example, I can't meditate because it drives me crackers and it makes me feel more stressed. But I can walk my dog in the park without any headphones for an hour. And that really works for me because I like movement and I like some space. So I think it's about what works for you. You know, is it exercise? Is it physical activity? Is it time outside? Is it reading? You know, it doesn't have to be prescriptive. It can be whatever works for you. But we always say to people that we work with, think about it and make a plan for it, because it doesn't just happen. Like your kind of antidote for stress, no one's going to do it for you. Yeah. Because, you know, it's highly likely that you're female, because most people that we work with are female. They can't seem to carry the burden of the fertility responsibility. No one's going to come to you and say, okay, these are the things that you need to do. You're going to have to take that leap yourself, and you're going to have to kind of look after yourself. And it's, you know, well documented that women are not very good at looking after themselves or putting their own needs first. But it's about actively making a plan for your own needs and allowing yourself and giving yourself permission to do something that's enjoyable, relaxing, whatever it is, because that really will be an antidote to that stress. Because you might not be able to remove the stress, whether it's work, family situation, fertility. It's not going to go away. You can't just not be stressed about your fertility struggles. But it's about finding things, small things every day that are the antidote to that. So whether it's going to bed and not scrolling before you go to bed, you know, having a bath before you go to bed, reading a book, you know, going to bed early, whatever those things are, do them. Not doing the washing up, you know, and not feeling bad about it. You know, all of those things can really, really have an impact. But it's about small things every day, you know, rather than it be one big thing like a holiday or something, which is great. But it's about those day-to-day kind of activities that just bring your nervous system down and make your body feel safe. So I completely forgot what I was going to say. That's my menopausal brain. That's my hormone menopausal brain. Yeah, it's about whatever. Oh, I know what I was going to say. It's like in Chinese medicine, we talk about output and input because we're all about balance. So I always say to people that we're working with, think about how much your energy you're giving out on a daily basis. And then think about, where is that energy coming back in? Are you matching it back in? So, and the way you put it back in is you know, from a Chinese medicine perspective, is through rest, is through eating well, and through sort of, you know, talking kindly, nurturing yourself. So I was saying, at the end of the day, really weigh up how much have you given out and how much have you put back in, because that will really show you where imbalances lie.
And that's important to say, isn't it? Because one thing that I try to tell my patients a lot, and I've come like out of the NHS. I'm still working in the NHS, but I have a bit more time, so I'm doing some work outside of it now as well. And like with my community that I've built online as well, is that sometimes we need to pause before we jump into the next piece of action of what we're going to do, to actually research and understand yourself. And so a lot of the time you have people saying, well, I've done this, I've done that, I've done this. Like I go running and I try this app, this calming app, and like I'm just always stressed. And it's like, well, actually, have you taken the time just to pause? And what I call, for some things I call it a symptom diary, for some things I call it, you know, a journaling or a list, but actually to see how it's impacting you, and to see how each of the activities you're doing, how it's impacting you. And so to say that you're stressed, do you know that how your stress is showing up? So a lot of people, I sit down and I say to them, okay, so you're stressed, so like, how are you managing at work? Are you finding yourself falling asleep in the daytime? What's it like on a day off? And some of these questions that I'm asking, they're like, oh, I hadn't really thought about what it was like on a day off. I had a woman that came to me in GP land yesterday, and she walked in and she was so she was like, I just feel tired all the time. I don't know if it's my hormones that are off. I had like low vitamin D last year, so I don't know if it's that. And as she's sitting there, she's like getting redder and redder. I'm like, okay, what's going on here? Like, how has your mood been recently? And she's like, oh, I don't know, I just feel a bit overwhelmed. And she started crying. And then I said to her, well, you know, tell me about things that you do for enjoyment. And then she's like, oh, well, I used to walk my dog, but now I've got a rescue dog, and that's a bit stressful actually, walking him. I was like, okay. But what things do you enjoy? And she's like, well, I usually enjoy being with my friends, but like, it's just, I don't know, it's not so enjoyable now. I'm like, okay, well, have you actually looked into that? I said, when was the last time you had a week off work? And she's like, oh, I think it was about 3 months ago. I said, well, you said that you've been feeling like this for 6 months. How was it that week off work? And she's like, oh, actually, yeah, that week off work, I think I did feel a bit better. I think I cried a bit less. I'm like, so, and it wasn't until this conversation where we're asking these questions that she started to see that actually she's been in a job that she said the job isn't hard work, but she says that it's difficult conversations. And she hadn't really realized how those were impacting her, and how being at work was making her so stressed and down that when she came home, all she wanted to do was sleep, and she didn't want to spend any time with people anymore. And then we found that the crux of her issue and a lot of her stress was because she was in this job where she hadn't been prepared for some of the conversations she'd be having. And whether the decision for her is that she needs to change her work or she just needs to take time off, that's something that we're discovering. But just taking a minute to find out that, because for her, when she walked into the office, she hadn't taken a minute to look at what's been happening in the last few months. She just walked in and said, I'm more tired. It's because of my vitamin D, or it's because of my vitamin something, or you need to do some blood tests. And that's why she came to my room to ask that. But just taking that pause to stop taking action and just to reevaluate things to make a big difference. And you can see like the areas that you might need to improve things. And so, yeah, what you were saying, and then everything is so individual, isn't it?
Yeah.
Like you said, meditation doesn't help you. I know people that running really helps them. And when I run, it makes my whole body itch and I just can't stand it. But if I go and weightlift or if I go swimming, I'll have a great time. But if you ask me to run, you are going to stress me out completely. And so it's really finding those individualized kind of ways, isn't it?
Absolutely. Yeah, absolutely. And you're so right in that it's about understanding why somebody might be feeling that way. You know, it's about unpicking, isn't it? Because and I guess this is the kind of beauty of where, you know, if you can bring like Western medicine and Chinese medicine together, you've got a really beautiful and powerful approach to health, because you've got the science and the ability to affect change should you need to, but you've also got the time to really understand that person's health from a holistic perspective as well. So what is it that got that person feeling that way in the first place? Why did they come in? Is it, you know, is it tired from a physiological point of view? Like you said, like, is it vitamin D? Is it hormonal? Or is it because of the lifestyle? And people are often, you know, when I work with people in clinic, they are often blown away by the impact of how they might be feeling and thinking, how that shows up physically. In the body, because often it's like, well, my digestion's off, I've got IBS, it's so common, I've got IBS, it's because, you know, and often if you like, you know, have a holistic look at what's happening with that person, their stress levels are so high, they're so chronically high, they don't even know that they're stressed because they've been it for years, and their body just can't digest properly because it's not in a relaxed enough state. And I'm not saying at all that all IBS is, I'm not simplifying it, but I'm saying there's often a real lack of realization that what is happening to you externally really can affect how you are feeling physically.
Yeah, absolutely. And that is one of the main reasons I started this podcast, because a lot of people, when you speak to people, they understand there is an impact of stress, or they're like, oh yeah, I was more stressed, this happened. But sometimes we don't really acknowledge and accept the responsibilities that it does have. I would have so many patients that would come to me and they're not feeling well, they're having lots of body aches, they're having IBS or anything. And we're doing all the tests and everything's come back as normal. And it's like, but what's happening with your lifestyle? And it's really what you said about only you can change that. Only you can do the things that will impact on reducing your stress and, you know, doing those more healthy habits. A tablet won't do it a lot of the time. Majority of the time, a tablet won't fix things. It's something that you've got to do. And I hear, I don't want to say excuses, but I hear like the barriers that are there. And sometimes you've got to say, when are we going to overcome those barriers? You made an excellent point that for women, we are often in these caring roles where we look after everybody else and not ourselves. I've recently been running like a diabetes clinic, and I had a patient come in who was not doing almost any physical activity. When they're at work, they had a bit of an active job, but really there was like no physical activity there. I said, where can you find it? And they're just like, well, I can't, it's not practical. I gave them a goal for like a number of minutes a week. And I said, like, how can you practically find time for this? Can you find 15 minutes a day? Not every day, but just some days a week. It's like, no, it's like, I've got a 6-year-old child, you know, they dictate my time and I run a business and that dictates my time. He's like, I have no control. This was he said, I have no control of my time. I don't have any control of this season in life. And he said, before I had my child, I had more control, but I have no control now. And we've got to change that kind of mindset. We do have control.
Yeah.
We do. And we've got to find it.
And also, yeah, and in those situations, I always think, I always think you are setting examples for the next generation, aren't you? As a parent, it's important that you can show your children how you are able to look after yourself, because if you can't show that to your children, then how do they grow up learning how to look after themselves? If you're always kind of haven't got time, overrun, stressed out, then they are not, we all need examples in our lives of and I'm not saying there's perfection or anything, but it's about being able to prioritize your own health is one of the most important things to show to our children. I personally think, and however that takes its form is different for everybody, but often I think it is a thing, isn't it? I know we're going off a bit on tangent here, but mums are always kind of like the last on the list. And that is deemed to be by society, that's what a mother should be doing. They should be sacrificing.
Sacrifice.
And I think, and I'm like, no, I'm not having that, because I think we need to be at the top of the list, because then you are showing to your children, I can prioritize my needs, I can prioritize my safety, my health, my well-being, my mental health, and so can you too.
Yeah. And that's it's just such a good point. Is it like especially if you're going on this like fertility journey and you're trying to become a parent, using this time to actually learn how to prioritize yourself. We are told, you always hear, when people talk about their moms, they often talk about how much they sacrifice them, how much they sacrifice for me and everything. And I've always said, although sacrifice does come when you're a parent, you can't be selfish anymore. Like it's, even if you try to be selfish, that child will say, no, you're not sleeping right now. But I don't want my children to describe, when they talk about me and talk about how great that their mom is, I don't want them to say everything I sacrificed for them. I want them to talk about like all the things that I did, or doing the lessons that I taught them, not all the sacrifice, because that's just such a massive thing. And we do sacrifice. I want them to see us thriving as well. And so when you are going on this fertility journey, especially because I know most of my listeners, we've talked a lot about women here, but most of the listeners here are women. And when it comes to fertility, a lot of the onus does go into women, although there is a massive male factor that we have to talk about as well, because it takes two to create children. But when it comes to, when you are going for fertility and you are trying to conceive, you are going to become a mother, making this priority now, where you learn to put yourself on the list, you learn what your triggers are, you learn what things help to relax you. It's an excellent opportunity to do it now, so that you've got that muscle memory there. So when the children come and they start taking over, you've got that muscle memory of, oh, actually, I know how it affects me when I'm not sleeping well. I know how it affects me when I'm not eating well. I need to prioritize this, that I can be a good mom. And one of the best things that we can give to our children, to our family, is to live. And so taking time to actually look after ourselves so that we are living, is really important. But yes, we have gone on a bit of a tangent, but I think it's just really important to say that, to kind of bring that up. And but if you are going through fertility issues, my thing would be to say, taking away from this conversation, is that it's a very multifaceted, very complex area fertility is. It's not one thing that will fix everything, but it's a whole host of things, and a holistic approach and a Western medicine approach is often really essential. And so don't delay things, is what I would say. Unfortunately, as a lot of women's bodies and males' bodies as well, as we age, our fertility, women are born with all the eggs that we have, and the eggs are what we need to have children. And so with each menstrual cycle, our eggs diminish, and so we do have to take into account that age does play a factor. And so if you are having any fertility issues, rather than waiting, although in terms of like what help you can get through the NHS and things may change, you've got to have wasted a certain amount of time, but there's no harm in going and seeing somebody about it, whether it's somebody like Hannah and getting a holistic view of things and having all the areas looked into, see how stress is affecting your body, whether it's getting acupuncture, whether it's seeing your doctor and just getting some bloods done and making sure that you're not horrifically anemic, or that if you've been having really heavy periods, and checking if you've got fibroids and having a scan. Then there's no harm in actually looking into your body a bit more if you are on this journey, rather than waiting. The amount of people that I've seen who have been waiting 2 years, 3 years, and they've not gotten any help. And so just get some help. There is a lot of help out there. It's not just IVF. There's so many other things that can be done and started, but reach out to somebody.
Yeah.
Brilliant. Right, so I'm going to end it on that. Thank you so much, Hannah, for joining me today, and just sharing so much essential information. Would you mind sharing with the listeners and the people watching on YouTube as well where we can find you? I know you said that you've got a couple of clinics, you've got a podcast, if you can.
Yeah, so we're in South London are our physical clinics. We do online consultations. So you can have an online appointment with us where we go through your whole health history, we go through your menstrual cycle, and from there we can recommend whether we try and plug people back into their GP for blood tests, or lots of people nowadays are doing at-home blood testing, sperm testing, all of that kind of stuff. There's a lot that you can do yourself. So we can do online consultations, but we also have our Facebook group called Don't Tell Me to Relax, which has got loads of webinars. So I've done webinars on understanding your menstrual cycle, tracking your cycle, knowing when you're fertile, how to do BBT charts if you want to take your temperature every day, how to track the cervical mucus. There's loads and loads of webinars on there. So you can come and join for free. You can access all those resources. I do quite a lot of live Q&As if you ever want to come and ask questions, talk about your case. There's lots of community members on there. We've got a nutritionist, all our team are on there. So we're a team of 9. So we're all in there if you want to ask an expert. And obviously we've got the podcast. So the podcast is usually every week. And that really is, each episode is about a sort of snippet around fertility education. So there's usually something in there that it might help empower you or help improve your understanding of your own fertility. So you can really advocate for yourself, because I think that you do have to advocate for yourself. You've got to understand it. You've got to push for treatment. You've got to push for testing. So there's a lot of good stuff in there to just really help enable you do that.
Yeah, excellent. Brilliant. Thank you so much. Guys, please make sure you check out the podcast. It is excellent. Hop onto the Facebook group if you're struggling. And as always, we'll be back next week with another episode. If you've not subscribed, we're on podcast platforms, Apple and Spotify, under De-Stress with Dr. Amanda. And if you want to see our beautiful faces, you can also watch this episode on YouTube under Life with Dr. Amanda. So we'll see you next week, and thank you, Hannah, again. Bye.
Thanks.